Hi, my name is Max Silverstein, and I'm a third-year resident in the Division of Plastic Surgery at Stanford. I'll be presenting our study comparing Cortiva Silhouette to Alloderm for use in prepectoral two-stage prosthetic breast reconstruction. Acellular dermal matrix, or ADM, has been used in breast reconstruction since 2005 to improve soft tissue support, facilitate greater tissue expander fill volumes, and reduce rates of capsular contracture. The most popular ADM product is Alloderm Ready to Use, or RTU, made by Allergan. Alloderm is a human-derived decellularized tissue matrix. Cortiva, made by RTI, is another human-derived ADM available in multiple thicknesses. The newest Cortiva product, Cortiva Silhouette, is distinguished by its thinness at only 0.45 to 0.7 millimeters thick and lacks a base membrane, making it nonpolar. The objective of our study was to compare clinical outcomes of Alloderm versus Cortiva Silhouette for use in implant-based breast reconstruction. To do this, we reviewed all patients with at least 100 days of follow-up after immediate prepectoral tissue expander placement for two-stage implant-based breast reconstruction with a senior author. Cortiva Silhouette or Alloderm RTU were used interchangeably during the study period. In every case, a 16 by 20 centimeter piece of ADM was trimmed to cover an Allo X2 tissue expander. This is pictured on the right. The ADM was then sutured to the pectoralis fascia. Following expansion, the expander was exchanged for a smooth, round silicone implant. We compared outcomes of Alloderm RTU versus Cortiva Silhouette in terms of complications and performance. In total, 104 consecutive patients with 178 breasts were included in the study. The difference in average mastectomy specimen weight between the Alloderm and Cortiva cohorts approached statistical significance. Cortiva was associated with greater intraoperative tissue expander fill, final tissue expander fill, and silicone implant volume. Cortiva patients also underwent fewer fat grafting procedures on average. Alloderm was associated with a significantly greater incidence of any complication relative to Cortiva. This disparity derived primarily from the difference in rates of mastectomy skin necrosis. However, delayed wound healing, seroma, infection, and capsular contracture also occurred more frequently in the Alloderm cohort. In light of these results, it's important to understand the differences between Alloderm and Cortiva. Cortiva Silhouette is 1/2 to 1/3 the thickness of Alloderm. While Alloderm undergoes a proprietary irradiation process, Cortiva is subjected to the Tutoplast irradiation and chemical sterilization process, which is used to prepare a variety of allograft tissue products. Cortiva thereby achieves a 1,000 times greater sterility level compared to Alloderm. Finally, Cortiva is significantly cheaper in most cases. In conclusion, we found that Cortiva Silhouette was non-inferior to Alloderm RTU for use in two-stage implant-based breast reconstruction. Despite its thinness, Cortiva Silhouette supported greater expander fill volumes and larger silicone implants. Cortiva was also associated with fewer complications in our study, including seroma, and the thinness of Cortiva also makes it more flexible, which facilitates surgeon manipulation. Finally, Cortiva is generally cheaper than Alloderm at most facilities. Therefore, we suggest that plastic surgeons consider incorporating Cortiva into their breast reconstruction practices. Future studies will continue to compare Cortiva versus Alloderm in prospective controlled studies. Additionally, understanding the long-term durability of outcomes related to various ADMs is critical to determining superiority of one product over another. Thank you.